Well, good afternoon, everyone. Welcome to another installment of our industry meetup series. Tonight, we are featuring a number of healthcare professionals who are going to offer insight and advice into the world of healthcare management. I am Renee Dolio, the Recruitment and Enrollment Manager for Trellis, and it is my pleasure to be able to share amazing information with you about Trellis, the Trellis Hybrid College Program. Trellis is a really new and exciting hybrid college model that combines the flexibility of an online degree from Southern New Hampshire University paired with in-person personalized student support services from Trellis, located right here in the city of New Orleans. We're located downtown at 1555 Poydras Avenue, literally right across the street from the Superdome, where we are able to offer students an exceptional amount of personalized support, from admissions and financial aid support to academic as well as career support. My colleague Logan Perkins, who is our career coach, is on tonight, and he will be hosting this along with me. And we will get started in about a minute or so. We'll give everybody another opportunity to get on, and then we'll go ahead and get started and introduce you to our professionals tonight. And while we are waiting, if you want to, please feel free, drop your emails into the chat. We're going to use that information to contact you and follow up with you after tonight's event is over. It gives us the opportunity to keep you informed of all of the exciting events that Trellis is hosting. So even if it's not for you specifically, if it's for someone else that you know that might be interested in earning an associate or a bachelor's degree, or both, we can absolutely share that information so you can forward it to people that you are interested in sharing it with. Thank you. All right. So first thing we want to do is get started with introducing all of our professionals, and I'm going to turn it over to Logan to do a brief introduction. Logan, you good? All right.
Yeah, I was just starting that video. How you guys doing this afternoon? We're glad to have all of you on the call, obviously. And we have some great professionals that I'm going to introduce. Hold on just a second. All right, so first up we have Kimberly Thornton. If you could just raise your hand as I introduce you, or it could be a digital handshake, whatever you want to do. Kimberly Thornton serves with the front office operations of internal medicine, Texas Healthcare. We have Kendra Cannon, who is the Director of Accounting at Legacy Community Health. We have Briere M, who serves as a cardiovascular tech with Ochsner Medical Center. And we have Arielle Hollins, who serves as a multidisciplinary team manager at Our Lady of the Lake Cancer Center.
Awesome. Thank you so much, Logan. Now, what I'm going to do is give each of you an opportunity to give a little bit more in-depth information about yourself. So give me a little bit of background, your educational background, as well as your career background. It doesn't have to be super long, about a minute or two, explanation about where you've come from and where you are now, and we'll go from there. So we'll start with Kimberly.
Hello, everyone. So pretty much my background is I kind of did things backwards. I went to SUNO first, had no idea what I wanted to do with my life. I was like, this isn't for me. I had a cousin that said, I'm going to medical assisting school, come with me. And I did, and I ended up enjoying it. And as a result of Hurricane Katrina and moving to Texas, I moved from back office medical assisting, and I was trained in front office doing billing and coding, credentialing, referrals, and that's where I've been. In the office that I'm with now, the provider was with the larger group, and he decided to open his own practice, and he took me with him. So even though I don't do one-on-one patient care, most of my day involves getting referrals completed, prior authorizations for medications, and also tasking for insurance denials, making sure that my doctor gets paid. So pretty much I get paid to make sure my doctor gets paid. And I've been with him for almost 13 years. So it's a great opportunity. I really did not like the patient care side of it. Nursing was never for me, and I knew that, but the clinical, the administrative side is what I enjoy, and it's something that I've been doing, and I've been using that to get my degree because I don't have to worry about any student loan debt. The company is paying for my degree, which has been awesome. I don't have to worry about any debt once I'm done, and I'm doing it because I want the degree, not because I have to, and that's something that I really enjoy.
Thank you, sister of mine. Arielle, next, please.
Hey everyone, so I'm originally from Los Angeles, California. I got a bachelor's of science in kinesiology at Cal State Northridge. And while I was there, my intention was to become a certified athletic trainer, but that didn't happen. And I looked for alternative routes. I had a mentor named Dr. Frankie Augustine, who she really wanted me to get into clinical research, but I was not interested in research at all. And I told her I had questions about health administration. Well, she was a health administrator at one point, so she recommended I take an intro to health administration class. So I took that intro my senior year of college, and I really, really liked it. And my professor at the time said, if you really wanted to get into administration, then you need to work in patient access or patient registration. So after I graduated, I had met my husband. He was in college at Grambling. So I moved to Grambling, Louisiana. And that's where I started working in the emergency room. And that laid the foundation for where I went from there. And so that I could move up, I got a master's in health administration at Seton Hall. And that's just carried me to where I am now.
Thank you so much for sharing your story. Kendra Cannon.
Hello, everyone. As Renee mentioned, my name is Kendra Cannon. I want to start by saying thank you, Renee, for this opportunity. I'm so grateful to even be a part of this conversation. Okay, I'll jump right in. I've been in Houston for about 15 years as a result of Hurricane Katrina. I'm originally from New Orleans, which is where I matriculated through school, and I graduated with a bachelor's in accounting from Dillard University. After graduating, it took me about a year to find a position, an entry-level position, and it was actually with a home healthcare agency. Of course, I was brand new, didn't know anything, so it was just pretty much getting my feet wet, but Katrina came and relocated me very quickly after that. And once I got to Houston, I actually started working as an accounting clerk in the waste management industry. So while I was there, I went ahead and went back to school, got a master's in human resources management. Accountants we can be all facts and data, detail oriented. I kind of wanted to master the people skills side so that I would be prepared for any advancement. Like if I moved up, I wanted to be able to have people skills as well as the accounting knowledge. So after getting my master's, I got another position as a senior accountant in the oil and gas industry. I stayed there about 5 years, and I didn't really feel like I could move up anymore. I feel like I gained everything I could. So I started looking for more positions, and funny enough, that's when I ended up being offered an opportunity at a nonprofit healthcare company, which is Legacy, where I am now for the past 7 years. I work heavily in grants accounting. I manage a team. We pretty much manage all of the grant funding sources so that we're making sure we're billing all of our grantors and constantly receiving steady revenue to keep us afloat, of course, in addition to insurance claims, et cetera. I can say this is my favorite industry to work in. This work is extremely fulfilling. It's rewarding to work for an organization that specializes in helping people, healing the sick. I'm glad I had the other experiences with other industries. However, this is my favorite. I love my job, and I actually look forward to working every day. Thank you.
Thanks so much, Kendra. And last but not least, we have Briere.
Hi, I had to get that unmute. Hi, everybody. I'm Briere Wells, as she stated. Thanks for the opportunity. I guess I want to say my background is a little simple. I got my bachelor's degree at Xavier. Lo and behold, I had really no idea what I wanted to do in my life. I went to Xavier thinking I was going to be a vet. And I used to do a lot of volunteer work for like the zoo, the SPCA, writing centers, and everything. And slowly but surely, it just started setting in that this was not going to be the life. So not for me at least. And I was just all over the place. So I wound up graduating, and in the midst of that, I'll show you how all over the place I was. I added a minor of mass communication. So I had two minors, chemistry, because Xavier just does that when you major in biology, you have a minor in chemistry. And then I added a minor in mass communication because I was like, well, maybe I could be a broadcaster, maybe I can get into that, just, trying to figure out life. And so I graduated still trying to figure things out. It took a couple years. And then I got inspired. My mother actually got sick with cancer. And so just in the way they treated her, how those people, those therapists, the nurses, everyone, the doctors, how everyone just saw her through that process, gave her inspiration, gave her light on top of her family and friends. I was like, well, this is a great field to get into to just kind of help people along the way and inspire others. So I looked into it. Since I already had the bachelor's degree, I went into this certificate program for a rad tech, a radiology tech, layman's term, X-ray tech, take your X-rays. So that I wanted to get into radiation therapy, which is actually treating cancer patients, but this was a venue to that. So I got my certificate as a rad tech a couple years ago. I finished in December 2016, and I started working in diagnostic X-ray, just taking your basic X-rays, back, feet, hands, all that good stuff. So just doing that for a year, and I had an opportunity to move up. So a friend told me about this job as a cardiovascular tech. Basically, I work in a cardiac cath lab. It's heart catheterization. So if you think about heart attacks, anyone who has any stenosis or clots in the heart, sometimes we even do peripheral things dealing with your lungs. You have a blood clot in your lung, a pulmonary embolism, as you would know. Different things like that we take care of. And so that would allow me to get training on the job. So I was able to move up, get training on the job, and then study for my certification in that area. So I didn't have to go to school for that certification. I just took a couple classes, studied, and then took the test and got that certification. So that's how I became a cardiovascular tech. And now I'm moving towards radiation therapy. I actually just got into school, so I actually start classes next week, but it's just been an ongoing process. Thank you. It's just been an ongoing process of just growing in this field, and this field has allowed me to go into these different venues and just use it to my advantage.
Thank you so much. Thank you to all of our professionals for sharing your background, sharing your story. For those of you who are our guests who are on, and those who will be watching on the recorded video, one thing that you can hear is that everybody has a different educational background and a different path to getting to where they are now. And one thing you can hear from some of our professionals is that even once they are in careers already, they're continuing their education because you're always a lifelong learner. And so Trellis has a wonderful program actually in healthcare management, which is the non-clinical side of healthcare. As Kimberly mentioned, what she does is not directly patient care, hands-on patient care. However, she is making sure that patients are getting what they need. And we do have concentrations in that healthcare management program in both communications as well as global perspectives. And even further, we do have a Bachelor of Arts in Communications that has an actual concentration in insurance services. So that's insurance services across the board. So that can absolutely go into the healthcare field. So anyone who's interested in healthcare, whether it is clinical or non-clinical side, we do have an opportunity for students to get educated and for citizens of New Orleans to be educated as well. So as we move forward in our meetup event tonight, what we're going to do next is ask a few questions to our professionals and give them the opportunity to answer those questions. For those of you who are just getting on, please feel free to drop your email in the chat. We're going to use that to follow up with you following tonight's event, to let you know about other events that we're going to be having, as well as follow up with you if you or someone you know may be interested in earning a college degree, whether it's an Associate of Arts or a Bachelor of Arts degree. We want to be sure that we are here to support you. Also, if you think of any questions that we're not asking, please feel free to drop those questions in the chat as well. And if we have enough time, we'll make sure we get to those questions. So, professionals, are you ready? Everybody ready? So the first question that I want to ask you is, how did you realize you wanted to work in the healthcare field?
So I've always wanted to work in healthcare. This is probably like weird, but whenever I would go into the hospital, it would excite me. Like I would have like a little pattern in my heart. So I've always wanted to be in healthcare. I wanted to be a doctor. I wanted to do something clinical at first, but you know, life, partying, that kind of stuff got in the way, and I didn't study as hard as I should have, and science just, physics, anatomy, it just didn't work out. So, and I wanted to use the clinical background as a means to get to the administrative part. So really, it saved me a lot of time by not becoming a clinician, because I still ended up in the administrative role. But it's just always been a passion of mine.
Okay, so I'll be honest, I had absolutely no interest at all in being in the medical field. I'm an accountant. We are taught that you pick the most lucrative, the busiest, and I'm like, oil and gas. I'm gonna be rich if I get in oil and gas. So that is where I'm going, and I'm in Texas, the oil capital of the world. So that's what I'm gonna do. And I'm in the field twiddling my thumbs. So healthcare ended up being an option. I'm so glad that I did it. Like Houston, Texas, period, is just a mega center of hospitals, clinics, just different things. You can really, there are so many opportunities here. So to me, being in Texas healthcare was definitely a more lucrative option. And then two, the perk that I mentioned before of actually helping people. So your job is a part of a bigger cause.
Awesome. Anybody else, Kim or Briere, do you guys want to tackle that question, or we can move on to the next one?
I'll just put my 2 cents in again. Once again, it just kind of, me being an all over the place person, wasn't as inspired in college, and like I thought healthcare in a different way as far as animals, I guess I should say, but you know, lacked the inspiration there. And once again, just being inspired through family, my mother mainly. And I failed to mention my uncle actually had a heart transplant a few years ago. And so I actually see him when he comes into the hospital for some of his visits, because it's in our department. So it's just being able to be a part of that and be a part of people's lives, and just those transitions for them. It's been amazing. And so the inspiration mainly was family, and then from there, just continuing to be inspired by the patients that I see.
That's really awesome. Thank you so much for your insight, guys. Logan, you want to ask the next question?
Yep. So what are some strengths that you guys think are crucial to being in the healthcare industry?
I'll go. Patience is definitely one of them. When you're dealing with healthcare and sick people, even if it's just over the phone, just having empathy, because a lot of them, they just want someone to listen to them. They want someone to know that they care. So that is, I think, one of the biggest things. And you deal with so many different people from different backgrounds. You have to be empathetic to each and every one of them, because if not, they're going to feel like you're pushing against them and that no one's listening. And then healthcare staff,
really has more interaction with patients than the doctors do. So you are a representative of the people that you work for. So if a doctor's office staff isn't doing what a patient needs, they're going to automatically look for a different provider, and we see that all the time. So you have to be very caring and very patient with everyone, no matter what.
Well, I think flexibility is a key component. Healthcare is always changing. It's one of the industries that's going to constantly change. I think, with the virus right now, we've seen an influx of telemedicine. That's something that's been pushing through for years, but now it's essential. So flexibility, and then I even think about flexibility in terms of looking for a job. As Kendra mentioned, Houston is a huge healthcare city. I left LA, which is a huge populated city in general, and went to Ruston, Louisiana, where the population was the size of my university. But making that move, it allowed me this opportunity because it was a much smaller market. Whereas now it's like, okay, now that I'm wanting to get higher and higher up, you might need to go into like a Houston market where there's more positions available. So I think flexibility in terms of just learning the industry and navigating day to day, but also flexibility in your career opportunities as well.
I know you had something to say as well, Briere, so you come off of mute.
Mainly, they kind of hit it on the head. Just the empathy part, really important. We go so many times we focus on self. We don't really think about what this person may be going through. We just think about where we're at the moment. And I think you have to really take that into account when you work in healthcare. You can't be focused on self at that point because you just don't know what that person has had to deal with up to this point. So empathy is really important, and like she said, flexibility, because with this working in healthcare, I can just piggyback all day. Things are ever changing. Working in my field, especially, things are ever changing. I have to deal with what's called excuse me, my mouth is all kinds of jacked up. I had 4 wisdom teeth pulled Monday, so yeah, I'm trying to make it work. But flexibility. I take call, and at any given moment, actually, I dodged a call today. I was supposed to go in for a case, and I told this lady that I had just taken some hydrocodone, which I did, so I couldn't make it. But at the end of the day, it's being flexible. Being able to work with these doctors, work with these patients, because not every case is the same. If you are dealing with one-on-one patients and dealing with cases, or just dealing with procedures, or just dealing with that patient that you just never know what's going on. Everything is ever changing. And especially with this COVID, the hospital flipped upside down. Everything had to just change almost instantly. So flexibility, empathy, and definitely need your coffee.
Thank you for that honesty, making sure that you have coffee, because, being awake and having energy is something that's really great in that industry. Next question is this. What do you guys find to be the most rewarding about the healthcare industry? So what is rewarding for you?
As I mentioned before, helping people. And the company that I work for, we specialize in helping indigent people who may not have somewhere to live, so we literally take care of them. So for me, it's fulfilling because everybody doesn't have insurance. Everybody doesn't, and we also specialize in AIDS patient care. And a lot of times, people can't afford that medicine. So that's where I come in. The grants that I manage are grants to help fund AIDS care and to help them get better if they can't afford it. So that's what's rewarding for me.
That's awesome.
I would agree with that. The patient outcomes. Currently, I'm the multidisciplinary team manager at the Cancer Center. And that's just a mouthful of when I started, I didn't know what that meant. Like I'm used to a lot of structure. And when I got into the role, there was no structure. My job was to manage these multidisciplinary teams. So we have like a lung disease site, head and neck cancer, manage these teams, work with the doctors where I look at research and articles and find new things that we can do to improve patient care. So there's a lot of flexibility with that. And just being on the administrative side and putting in the process improvements that we know will downstream affect the patients and improve their care has been really exciting. One of the big projects I've been working on for the last 2 years is the implementation of a software that will help detect early stage lung cancer. And it's going live right now while I'm on maternity leave. So it's like, this is like one of those big things that, you work for in your career, and I'm missing it out just a little bit. But the bigger picture is that we're going to be able to detect lung cancer early, which means that these patients will have a longer survival time and possibly decrease mortality. And on the other side of it, it brings in revenue to the hospital. You kind of can't talk about healthcare without talking about the business side of it. And healthcare is a business industry. So I'm excited to improve on patient care, but I'm also excited to improve the business side of our organization as well.
We're talking about rewarding, like everyone said, of course, patients, just seeing the outcomes. And for me, getting into this field, it was much more in my face, the outcomes, because we almost see instantly how we save this person or how we help this person. Sometimes it's actually saving that life right then. Sometimes it's just making it better for them to get through their day-to-day process. So in that instance, you put all things aside and you're just like, wow, we just did that. And to go back to what's important in healthcare, I forgot to say teamwork. Working well with others is so important, because you're just not working with that team right there in that department. You have to just think about it's all around. Like I even think to EBS Environmental Services, whatever we all can do to help each other out and make this whole process a better process, and at the end of the day, make the whole patient experience a better experience, that's a part of the job. And so that's one thing I want to add to that, teamwork as a whole, not just in the department.
Thanks so much for that. Logan?
So now we talked about what was the most rewarding. What do you think is the most difficult thing about working in the healthcare industry? I see y'all smiling. Come on, let it out.
For me, Arielle mentioned earlier the flexibility.
I would say one of the most difficult.
Oh, she froze up.
Kim, we didn't hear what you said. You froze.
Yeah, it's frozen.
You're good now. We can hear you now.
Oh, okay. I guess everyone spoke about the flexibility and the constant changes, but that can be a downside as well. Like they said, with this new corona thing, it really flipped everything upside down. And the office I work in, we're a population of patients, majority Medicare patients that are over the age of 65. So trying to transition them to virtual visits when most of them don't even have a smartphone was so frustrating, but you still have to care for your patients. So trying to get them, okay, like, do you have a grandchild? Do you have somebody, like walking them through even getting FaceTime or dual mobile set up on their phones or a neighbor's phone, or like that to me has been one of the most difficult things so far. And it's been a process. And just like they spoke on before, it's constantly changing, whether you're dealing with coding that needs to be used, and now insurance companies, they have a whole different set of rules that we have to follow for these virtual visits. So the patients aren't face to face. how do we know that they're checking their blood pressure correctly? And insurance companies will really penalize you and take money back from a physician's office if you don't use the proper coding and documentation when all of this is new. And literally we're getting emails daily with, oh no, you can't do it like this. It has to be like this. And it's ever changing. So like I said, even once you have your degree, making sure you get the proper certifications and continue learning, because what's going on now isn't going to be the same thing a year from now. So it's always learning and always studying and trying to find out what the next thing is, because again, the virtual visits, that stuff is here and it's going to be here, because this virus really show that we have to be accessible to our patients in many different ways, and not just by them coming into the office.
I would say the politics. So when I went to grad school, you know, there's a series of courses that we took, and at the last session, the administrator or the director of the program, she said, what is one thing that you wish you would have learned? I said, navigating the politics of the office. Like, I am not a person to just be coy about things at work. I don't want to manipulate this person over here and manipulate that person to accomplish a goal. And so much of healthcare, because it is a business, is the politics, and one person has this plan and somebody else has this plan, and then you have to, like I said, you're basically manipulating people to get to the common solution. So that's the thing that I don't like the most and is the toughest, but I think you have that in any industry.
So true, so true. Every industry has that. So kind of echoing on what Kim asked, what Kim was discussing a second ago. Sorry, something that she was talking about a second ago. How do you guys stay informed on the newest healthcare advancements? I know, like she said, everything is constantly changing. How do you stay informed about all of the changes that are happening in healthcare?
I can speak from the accounting side. We find out after it's happened. And like Kim said a few minutes ago, you're trying to bill and they're like, no, that's wrong. You can't bill a virtual visit without this. So it's always, it's behind the 8 ball, but it is what it is. Definitely challenging, but you just adjust.
We literally find out about changes by checking our email every day, multiple times a day, because that's how often things are changing right now. And I just don't, and just to speak on what they were saying earlier too, with the politics, not just that, but people don't realize that insurance companies hold so much power over medical decisions that are made, whether I think my patient needs a CT scan. If the insurance company says no, they're not gonna get it. And it's hard to relay that to patients, because all they're saying is, well, my doctor's office or the hospital isn't doing what they're supposed to do, when really a lot of the decision making is not in the hands of the provider. Insurance companies are really guiding a lot of the way medicine works right now.
Would that be, go ahead, Briere.
Sorry. I was just gonna, I'm always piggybacking, I love it. But the email, for sure, we are constantly, I have downloaded the work email app because we're constantly getting emails updating us on what's going on in the hospital, outside the hospital, just a lot of different things. So it's important to keep up with those. But also, as far as just the changes in our field, I have to do something called continuing education. I have to get those credits to keep my license up. So with that, you constantly are being updated how they're updating in my field personally. And I feel with anyone, they're constantly getting updated in that way to kind of keep up with their licenses or what so have you. So that's all I got to say about that. Go on, Logan, my bad, sorry.
I just want to add something before you say go, Logan. Sorry.
Yeah, Arielle, go ahead.
One of the ways that we try to stay ahead of the curve is, like I said, a big part of my job is reading medical journals, seeing what the newest trends are, but also collaborating with my partners. So the cancer center that I work in has several different locations in the area. And so I've talked to my counterparts and see what their multidisciplinary teams are doing. And the software that we purchased for our lung cancer program is something that our counterpart in St. Tammany Parish was purchasing as well. So those are the things that, and then attending conferences. And of course, conferences are going to look a lot different going forward, but that was another way that I was able to connect with some colleagues that I met that were from Kentucky, and they had a lung cancer screening program. And just to be able to see what people are doing in different areas and seeing what fits for your organization.
Great. So kind of getting into what we kind of talked about a little bit earlier, obviously you guys have mentioned so much about COVID and how things are changing and how things probably won't ever be the same. So in thinking about that, how do you guys see healthcare progressing in the next 5 to 10 years? Like, where do you see healthcare?
More focus on wellness.
And let me just say that Selena, that's on here, is also a healthcare professional. So Selena, please feel free to jump in and answer any of these questions as well.
Hello, everyone. Yes, as you mentioned, I'm Selena McCord. My background is slightly different from some of the professionals that you have before you on this panel. I started off in healthcare management with my bachelor's degree, and then I took a different route, wanting to understand more of those social determinants of health. And so I got a master's in public health. So right now I work on the consultant side of assisting these hospitals in preparation for population health management, which is the future of healthcare. I think Kimberly mentioned it when she talked about a lot of the decisions come back on the insurance companies. And so with population health management, payment systems are changing. They're not going to be paying people based on the number of people going in and out of the door. Payment is going to be based on quality. So if you're having folks coming in back and forth into the ED, you're going to get docked for that. Sorry, my 2-year-old is over here. But just to answer your question, I see telehealth as the future of healthcare.
I'm sorry, you guys. For the people that may just be on the call listening and it's their first time hearing about healthcare, could you guys give us a better example of what telehealth is exactly?
So telehealth is just that. Your provider is having, instead of going into the doctor's office for your visit, you're doing that visit remotely. So I just had a baby, and actually because COVID hit during this time, 3 of my OB appointments were virtual. And I think Kimberly or Kendra mentioned it with the blood pressure and taking an accurate blood pressure. My first visit, she was like, "Did you weigh yourself? Did you take your blood pressure?" I'm like, no, I didn't know I was supposed to do all that. So, and then I think, oh, my heart rate, it was just a plethora of things. But I think that is the next way. That's what telemedicine is, just being able to, for the provider to connect to the patient remotely.
My opinion, it kind of sucks. I hate telehealth. Sorry, just throwing it out there.
I think a lot of doctors are loving it though, because it kind of brings down that time in clinic. You know what I mean? As far as like spending so much time in there, it kind of gets straight to the point and kind of makes things happen more swiftly. You know, for them, they have to be in so many places at once. So I want to say doctors are loving it. So you're definitely going to be seeing more of that telehealth, my dear. Sorry.
Thanks so much for the information. So one final question that we have, and again, if any of our guests have any questions, please feel free to drop them in the chat. But one question that I do have for you guys, what advice would you give to somebody who's interested in delving into the healthcare industry? Don't all answer at the same time.
Well, I'm going to give the same advice that my mentors gave me. If you're in a program and you don't know what you want to do, or you're kind of thinking about health administration, if there's an intro to health administration class available to you, take that. And then what my professor told me, to work in patient access, that really gives you like the layout, the landscape of a hospital. If you know nothing about a hospital particularly, you don't know what a radiology department is, you don't know a lot of things, working in the emergency room or working in registration will teach you the landscape, and that'll let you know which way you want to go. One other thing is, a lot of people think about healthcare just as in a clinic or a hospital. You can do human resources, as Kendra stated, she does accounting, you can do marketing, like you can, because you kind of have, I hate to keep saying it's a business, but it's a business. So anything that you can apply to a business, you can apply to healthcare.
I agree with that.
Anyone else want to chime in?
That is so true. And I also think that never say that something isn't your job. Learn every part of every department as much as you can, because you don't know how that can push you forward and get you in a better position, whether it's just for more money or room for advancement. Because again, I was only back office. I had no interest in learning the billing side of it. But once I did, I'm just grateful that someone was there to teach me to do it. And I was able to move up and move forward because of it. So just learn as much as you can. Ask questions, no matter what department you work in. If you want to know something more about how the training department goes, also electronic medical records. Healthcare IT is a big industry, and it pays very well, and it has no patient interaction. So again, the IT, that's some certifications that you can earn online while you're doing whatever else that you're doing in the meantime. So again, just get as much information and learn as much as you can about every aspect of the healthcare industry instead of focusing on just one department.
I will also say this. I feel like in every hospital or in a lot, there's always a volunteer services. And I feel like if you get involved with them, you can get some hands-on experience in a place that you may feel that you're interested in. And also with different schools or programs, they may have meetups. At this point, it may be virtual, but at the same time, they they have the information for different departments available for you to get an insight to what that program may have for you. So I would just say that I wasn't a part of one, but I tuned into one this summer just for fun. But volunteer services is a good area to check out in your hospital.
Thank you guys so much. I really appreciate all of the insight that you guys gave into the healthcare industry. So to kind of wrap things up, I want to thank everybody for coming on tonight, but especially want to thank all of our professionals for taking the time out to offer your expertise in your given area within healthcare. Just to give you guys a little bit of just the whole spiel about Trellis, we do have a healthcare management program, both in AA as well as a BA. Again, as I mentioned at the beginning of tonight's event, Trellis is a hybrid college program that has partnered with Southern New Hampshire University to provide a flexible affordable college degree program. So SNHU provides the AA and BA programming, and Trellis provides the personalized student support services that traditional online students don't receive generally. So we want to make sure that students have support every step of the way. And I am responsible for making sure that students get admitted into the program. So if you or someone you know is interested in learning more about getting a college degree, getting into the healthcare industry, just so you guys are aware, particularly for those who are not from the area, Tulane University and Ochsner are two of the largest employers in the state of Louisiana. And so those are both very strong medical industries, medical employers, and they obviously are hiring for more than clinical side of healthcare. And so there are tons of positions that are available. I know Tulane is always hiring. I know Ochsner is always hiring. And we know that with COVID, people are second guessing themselves about the healthcare industry, but know from our conversation tonight that there are so many more opportunities within healthcare that does not involve direct patient care. And so you have opportunities there, and there is opportunities to be educated in the field. And as Arielle mentioned, make sure you take some of those classes. The cool thing about our particular program is that it is a competency-based learning model, which means students work on projects that demonstrate mastery. And the cool thing is that it's not a letter grade outcome. However, SNHU professors review those projects, they review that project work and will either give you a mastery or a not yet. And when you get a not yet, you have opportunities to continue working on those projects until you do master it. So in essence, as long as you're submitting projects, you can never fail it. The cool thing that is also about our program is that it's really affordable. We're on a trimester system and tuition is only $18.33 per trimester. For those who don't qualify for federal aid, there are scholarship opportunities that are available, and we are always awarding students full tuition scholarships to help fund their education. So we hope that from tonight's industry meetup that you've really gotten some really great insight into our program as well as the professional side of healthcare. And we thank you so much. Logan, I'm gonna turn it over to you to close everything out.
Yeah, I just wanted to say thank you guys. It was a lot of Black Girl Magic tonight on this call. I just wanted to say thank you again. Renee kind of talked about it a little bit, but having those ideas of those different career pathways within medicine, I know a lot of my students, I worked at Xavier, and everybody who came to Xavier was going to be a pharmacist or a doctor, not knowing all the different other pathways that they actually have in healthcare. So you guys exposing those different careers and talking about those different pathways kind of sheds light on the different things for people to say, all right, you know, maybe I don't want to be a doctor, but I can do this or I can do that. So opening up those different pathways and allowing students to understand that even once you get into that pathway can change, or you can grow within that pathway. You can get additional skills and move up within that pathway. A lot of people think that, you know, that it's just a dead end. You know, when you become a doctor, obviously that's your career. That's your career for, unless you change, but most of the time people are doctors. They're going to be doctors. Whereas you guys are in different positions where you can grow and you can lose all these different transferable skills that you're gaining. And the program that we offer, the healthcare management program, is just another way in which you can build those competencies and build those skills whereby you can be marketable within the healthcare field. You can be marketable within IT, healthcare. You can be marketable in all those different fields. So just making sure that you look into it. If you have friends or family members who are not in college and thinking about college, this is an excellent program. Like Renee said, it's very affordable. It's accelerated. Students move at their own pace. And it's accessible. A lot of students are oftentimes right now having a hard time deciding if they want to go to campus or if they want to do this or they want to do that. A lot of our programs are online. Books are online, so students don't have to worry about so much. So just thinking about it, you can always visit our website, and I'm going to put it in the chat right now. But thank you all again. We really appreciate you all, and thank you for sharing your backgrounds with us.
Thank you so much. And follow us on social media. We are on Facebook at Trellis and on Twitter and Instagram at Trellis_NOLA. And we are new to TikTok and Snapchat as well. So if you particularly have some younger people in your life who they like to use TikTok and Snapchat, please tell them to follow us. We're gonna be introducing some new TikTok challenges soon that we want everybody to get on and have some fun with that. And if you came in a little bit later, make sure you drop drop your email into the chat. We're going to follow up with you after tonight's event. So again, thank you so much. It was a pleasure meeting all of you and being on with you tonight. And we hope that you had a good time. So everyone have a great night. Thank you.
Thank you. Good luck, students.
Thank you.
Thanks. Y'all have a good night.
And congrats, Briere.